Welcome to my podcast, Soma Says. Thank you so much for joining me, Dr. Chhada. I just wanted to find out before we start about where you're practicing currently and what made you decide to go into gastroenterology.
So my practice is located in northern New Jersey, Bergen County, New Jersey, in a town called River Edge. It's very near Hackensack University Medical Center, which is the practice that I'm affiliated with. The hospital that I'm affiliated with. The practice that I belong to is called Gastroenterology Associates of New Jersey. And I think the second part of your question was what made me interested in this particular area. And I think it dates back to my residency when there weren't as many female physicians in gastroenterology. And I would have female patients looking for female physicians in that particular specialty. That was one reason. The second reason is I just find it very fascinating. The number of different organs related to the GI tract and how they interact with each other and how they contribute to our health. So I think those are the two main reasons that I chose this field.
And I know one of the topics that you're very interested in is with women's health and how the different changes that we go through. And I think our whole lives, like we're going through hormonal fluctuations from puberty to pregnancy to perimenopause and menopause. And a lot of my patients are very interested, especially since there's more of an awareness, thankfully, about how menopause and perimenopause affects women. And a lot of my patients want to learn and understand about their bodies. Can you explain how these hormonal fluctuations throughout a woman's life can affect their GI health?
Sure. We can start with just understanding that our body produces several hormones, estrogen, progesterone, as well as testosterone. The primary estrogen that we're talking about is called estradiol or E2 estrogen. That's the main hormone or the main estrogen that's produced by our ovaries once we hit puberty. So pre-puberty, we don't have the same high estrogen levels that we do after puberty. We do make some estrogen in our fat cells. However, once puberty hits, our ovaries begin producing estradiol. And going through the menstrual cycle, you can see how these hormonal fluctuations happen on a regular basis in most women. And when these hormonal cycles happen, we see the changes in gut issues and things like that. So understanding when these hormones peak and decrease during the cycle is really key to knowing when those things are going to hit, when you're going to get the constipation, the diarrhea, the bloating, etc. The reproductive years, let's call it. And then we can talk about perimenopause and menopause, dividing a woman's life into those arenas. So during those reproductive years, let's start with the menstrual cycle. So when you menstruate, day one is when you have when the shedding of the uterine lining happens. At that point, your estrogen or your estradiol level is very low. As soon as menstruation is done, your estrogen level starts increasing by the growing follicle or follicles in your ovary. As soon as you ovulate, those estrogen levels start declining again, and your progesterone levels start going up. And right before you menstruate again, your progesterone levels drop. So each of these peaks and valleys of our hormones correspond to different symptoms that we can see, particularly GI symptoms. And for example, right before menstruation or when you're menstruating, many people describe having diarrhea or loose stools. Before that period of time, many women get constipation. And there are different things that are happening at that time, and those relate to our hormones. And these are very common things that happen to most women. And predicting those things can be really helpful, in terms of thinking about how you're going to treat it and how you're going to deal with those symptoms.
So let's start with someone who is having more of the diarrhea and the bloating perhaps before their cycles.
Right.
What would you recommend to them if they came into your office?
It's interesting. We have estrogen receptors on our gut. We actually have estradiol receptors on our gut. And I don't think, and different people get a different degree of symptoms. And I don't think it's because they're abnormal or they have abnormal levels of hormones. Maybe they have a different amount of receptors on their gut. When you get that diarrhea, you can symptomatically treat it. You watch what you're eating. For the bloating, limit the salt intake, for example. You can take antidiarrheals if you know it's going to come on. But one interesting thing is, so the reason that we get the uterine shedding and also the cramps during your period of menstruation, is that the uterus produces a hormone-like substance called a prostaglandin. These prostaglandins also act on our gut and they cause cramps. And then those can increase diarrhea. So it's interesting. How do you reduce prostaglandins? You can take ibuprofen. And that can really be helpful to women. So when women take that ibuprofen right before their period, it can also reduce the cramps and sometimes the diarrhea, which is a little bit interesting. So I generally tell women, have a high fiber diet, soluble fiber. It'll make your stool a little more solid. Limit the salt intake, stay hydrated, and then take some ibuprofen to reduce that prostaglandin production. That can be helpful, particularly to people who are having a lot of cramps and bloating and diarrhea.
And let's go forward to someone who is perimenopausal or menopausal. What are some of the GI issues that you commonly see in these sorts of
Everything.
patients?
I see everything. So what do I see? Increase in acid reflux. I see constipation, diarrhea, more bloating. And there are so many reasons for this. And I don't think they're conflicting studies. We do know that during perimenopause, estrogen levels are all over the place. Some months you are producing follicles and ovulating, and some months you are not. And the changing levels of hormones can affect the gut as well. So studies do show that there is an elevation of acid reflux during menopause. It can be a little confusing because you would think that there would be less acid reflux, but there does tend to be more acid reflux. And again, these ups and downs give women different symptoms. I see women with constipation, diarrhea, and bloating.
I would agree with you. That's been my experience as well.
Yeah.
Have you seen where women who may be in this stage of life, when they go on hormone replacement, if these symptoms improve for them?
That's interesting too. Yes and no. So there are definitely things that improve with doing hormone replacement therapy. There are a couple studies that show that acid reflux might be a little bit better. A major thing that happens is that there's a decreased risk of colon cancer, which is also interesting, and a couple of studies that show decreased risk of gastric cancer. As far as symptoms, though, I do see women in both aspects. Some women get much better on hormone replacement therapy, and some women don't. And this might have to do somehow with the gut microbiome, but we don't really have enough research on the gut microbiome, which is another interesting topic on how that changes during perimenopause and menopause.
And I understand that a lot more research needs to be done regarding our microbiome. But what I'd like to learn about, I think I need to learn about this, and perhaps you can help me with this. How do hormonal changes affect the gut microbiome?
It's interesting because there's a study a while back on fraternal twins, and they looked at boy-girl twins and they looked at same-gender twins. And what it showed is that the male-female twin, their microbiome was much more different than the same-sex twins. And, what does this mean? This means that the hormones, sex hormones, estrogen, has a very big effect on the gut microbiome. When you go through menopause and the estrogen levels go down, you see a decrease in the diversity of the gut microbiome. The gut microbiome actually and estrogen have a bidirectional relationship. which means that estrogen is actually reactivated by the gut microbiome. So the gut microbiome is making estrogen and reactivating estrogen. And you also need a good microbiome in order to do that. So there are changes. I think this is going to be a great area for future research because we don't know so much about it and why that's happening. But how can you manipulate the gut microbiome in order to ease menopause and perimenopause symptoms? And that might be an area where we can have some benefit in the future.
I don't know about you, but as an internist, right? And it's like a constant battle that I have to fight at times. Oh, I have a cold. Can you nip it in the bud? Can you give me some antibiotics? Or
Right.
I'm having a sore throat. Can I have antibiotics? And this allows me to talk more about the microbiome and why it's important not to treat each and everything without actually knowing if it requires antibiotics or not. I just came off doing a podcast with a dermatologist, and she was saying that before, things like rosacea and acne were treated for months and months with
Right.
antibiotics, and they know now they're realizing that there are consequences to that, that we're doing probably more harm than good. How does that apply in the GI world?
I 100% agree with you. 100%. We want to limit our antibiotic use to when we know it's poorly affecting somebody. A lot of infections, our bodies are amazing. Our bodies can take care of a lot of things. It can take care of so many types of infection. And once you start giving antibiotics, it's like a nuclear bomb goes off in your intestinal tract and can destroy a whole village of a very important flora that are doing so many things. Reactivating estrogen is just one little tiny aspect of the importance they play in our life and our health. So I agree with you that antibiotic use, I think, is decreasing. It should decrease. I try to counsel patients on that as well. Let's try and avoid antibiotics here and eat well, have some healthy pre and probiotics through your food, not necessarily dietary supplements that aren't necessarily regulated, but through our food, let's try to elevate our microbiome.
I wholeheartedly agree with you. And I hope one of my patients is listening to this podcast because she came in. And I think in that way, having more of an awareness is helping women because she went to her GYN's office, she was seen, and she was dismissed
Mhm.
about some of the issues that she was having. And she came to me and I felt bad because she was like, I'm not sure, should I be asking my primary care, an endocrinologist, a gastroenterologist, or my gynecologist about some of the GYN issues and GI issues that I'm having. I'm like, why don't we start with your PCP first? And
Right.
then I can figure out what I can handle. And if I can't handle all of that, we can figure out who else takes over from here. But pretty much 90% of it was being addressed by me, even some of the GI stuff.
Right.
And I think in that way, patients, and then this is why I'm so glad, I think patients are advocating for themselves. Women are advocating for themselves more. So in that way, I'm very glad that there's
Yes.
more this movement and there's more on media and there's more being coming out about that. And doctors like yourself who are advocating for women patients. So thank you so much for
Well,
being on this podcast. Thank you for the time. Anything that else you want to
no,
do?
I really thank you for the opportunity to
Sure.
do this. It's something that's like really near and dear to my heart. And I really appreciate your time and allowing me to do this. It was really fun talking to you.